Welcome, I am Terry Tropin, and today I'll be discussing the changes in ICD-10-PCS for 2026. These are effective October 1, 2025. So first, let me tell you about myself. I have a Master's in Healthcare Administration Informatics, an RHIA, and a CCSP. I'm a HEMA-approved ICD-10-PCS trainer. I am technically retired, though I'm working as much as ever. I was an adjunct professor at Montgomery College, Silver Spring, Tacoma Park, Maryland. I have a series of books on Amazon Medical Coding Made Easy, and I also have, in addition to this YouTube video, videos on PCS, CM, and E&M guidelines. Okay, so here is an overview of what I'll talk about today. So the 2026 changes effective October 1, 2025, and new material in these slides are in bold, and deleted material is crossed out. Changes were made to these tables. Medical and surgical sections, 10 tables were revised or added. Medical and surgical related sections, 4 tables were revised. And new technology section, as always, there's a lot of changes in that. 17 tables were revised or added. So how does this compare to this year? So in 2025, we had 78,986 codes. 156 were added, 27 were deleted, so that gives us a total of 79,115. Now, my math is not all that great, but I come up with 129 codes, additional codes for 2026. Okay, so this presentation includes the major changes. The changes are posted each summer by CMS, and here's where the link to those that list. In addition, if you want more information about any of these changes, descriptions of the procedures, rationales for the procedures are in the minutes of the ICD-10 Coordination and Maintenance Committee meetings. And here is the link to that. This is a lot of information in there, like how's it coded now, how should it be coded in the future, a lot of new products and stuff. So this is really good information. Also, the meetings are recorded, and you can go in and listen to them and get free continuing education credits. So that's something to think about also. So it might be helpful for you to get your CPS book out and follow along with these as we go. So start with the medical and surgical section. Changes were made to these body systems. Medical and surgical section, first character 0. Central nervous system and cranial nerves, second character 0. Heart and great vessels, second character 2. Upper arteries 3. Ear, nose, sinus 9. Mouth and throat C. Hepatobiliary system and pancreas F. Upper joints R. Lower joints S. So let's start with the tables that begin with 0, 0. So this is the central nervous system and cranial nerves, removal and revision. So this is 00P and 00W. Okay, new rows were added. Now if you look at the picture, you see the kind of chain link thing in there. That is what we're talking about. It's a device placed in the cranial dura and spinal meninges to support one with weakened or absent presence. So removal or revision of these devices can be required if there's an allergic response to it, if it becomes infected, if the tumor that it was removed for regrows, if it's a cyst, if it's a meningocele of the cranial dura or a myelomeningocele of the spinal meninges. Okay, so this is a new device value, interluminal device, endovascular anchors, value L. So this anchors the device to secure the graft to repair an aortic aneurysm. So that's the nervous system. Let's look at the heart and great vessels. So there was a new qualifier value added, upper artery. Why? So this is for a bypass procedure in the upper arteries from the innominate artery to a subclavian or axillary artery. So from the innominate, which is the body system, and then upper artery, Y, for the subclavian or axillary artery. This is for a thoracic endovascular aortic repair procedure to treat an aneurysm or dissection of the aortic arch by creating pathways around the blockage. So if you look at the picture, on the left-hand side, you'd see the innominate artery. On the right-hand side, you see subclavian artery. So this is a bypass from the innominate artery to the subclavian artery or the axillary artery. It's interesting that they don't do separate values for subclavian and axillary. They just do upper artery Y. That's unusual because usually the tables are so specific. But in this case, upper artery means subclavian or axillary. And this is why looking at the minutes is important, because that's not indicated by the tables, but that's how they describe it in the coordination committee minutes. Okay, the next table is ear, nose, and sinus, and this is a transfer. It's table 09X. So this is a completely new table. So this is described the transfer of vascularized nasal tissue in procedures to reconstruct defects in the skull base. The body part value is K, nasal mucosa. This is a pedicle to reconstruct defects in the skull base. The qualifiers are frontal bone, ethmoid bone, occipital bone, sphenoid bone. So this is a transfer. So let's look at table 0C1 in the mouth and throat. This is also a bypass. So we have a lot of bypass and transfer procedures. So this is a completely new table added in the mouth and throat system. So an incision is made into the cricothyroid membrane to insert a tube. After the cricothyroidotomy, a permanent tracheostomy should be placed within 24 hours. So why is this done? Well, previously a cricothyroidotomy was coded using table 0B1 in the respiratory system bypass, the body part value trachea. Well, that's not anatomically correct. The cricoid thyroid membrane is part of the larynx, not the trachea. So this was incorrect anatomically. So therefore, a cricothyroidotomy is technically a bypass of the larynx, not the trachea. So this corrects that anomaly. So for a cricothyroidotomy, you're going to use device E, intraluminal device. For tracheostomy, use device F, tracheostomy device. So this differentiates between a cricothyroidotomy and a tracheostomy and puts it in the right anatomical area. Okay, so the next body system is the hepatobiliary system and pancreas. So this is also a bypass. It's used to report a coloductoduodenostomy, which connects the common bile duct and the duodenum. So body part value is common bile duct, qualifier value is duodenum. So this is a coloductoduodenostomy, a surgical procedure that connects the common bile duct and the duodenum to drain the biliary system. So let's look at what these look like. So on the left is the normal position. You see near the top on the right-hand side is common hepatic duct, and then under that is the common bile duct. And that carries bile from the liver and gallbladder to the pancreatic duct and then the small intestine. After the surgery, you see that the common bile duct on the right-hand side, the common bile duct goes directly to the duodenostomy, the duodenum. Okay, so let's look at table 0RR, upper joints replacement. Some rows were revised and other new rows added. So this is used to code a total shoulder arthroplasty using the subscapularis sparing technique. It's qualifier value 8. So this is for a specific product, a specific methodology called the Enhanced Shoulder System with humeral stemless anchor. It's used in cases of osteoarthritis, post-traumatic arthrosis, focal avascular necrosis of the humeral head. The humeral head is removed and replaced with a metal implant. You can see that in the picture, which may be stemmed or stemless, and the glenoid surface is prepared and replaced with a shallow plastic implant, which you can also see in the picture. So now we're going to go to lower joints replacement. New rows were added, and this is interesting. They're being very, very specific. It's medial meniscus and lateral meniscus of the knee. And you can see from the picture, lateral meniscus and medial meniscus. The meniscus, of course, is a structure within the knee joint located between the femur and the tibia on either the inside or the outside of the knee. And it acts as a shock absorber. The knee takes a lot of punishment, right? Walking and running and all of that. And the meniscus helps distribute the weight and the stress across the joint. So that's all the changes to the medical and surgical section. Now let's look at other sections. Most of the changes were to new technology, cardiovascular system. But there are other ones too. So let's start with the other ones. Table 5A0, extracorporeal or systemic assistance and performance. A new row for body system, circulatory A, its duration value, intraoperative A, function values, cerebral embolic filtration 6, and qualifier values M, N, P, Q. So you see in the picture the kind of gray dome sort of thing. Well, that's the filter. So this is used to code use of temporary intraoperative embolic protection devices to capture and remove debris that may dislodge during interventional procedures. So another procedure is being done, and in order to keep that debris out of the blood vessels, which you don't want things floating around in the blood, this filters it out. So now let's look at table 6A4, extracorporeal or systemic therapies. For the operation hypothermia 4, they added a row for the donor organ protective thermal insulation. This is used to protect donor urinary organs during transplant. Right now it's just for the urinary organs. I would be surprised if they didn't add other ones in later years. The qualifier value is 0. So table 8E0, other procedures, physiological systems, and anatomical regions. This is another one where they've added a code for a specific product, a specific commercial product, okay? As a new row added with body region none at Z to code histolog scanner, okay? This is used for a confocal laser system intended to allow imaging of the internal microstructure of the tissues, including but not limited to identification of cells, vessels, and their organization or structure, how they're put together. Now, this is a faster, clearer view of tissue. Like during a surgery, when they do a frozen section, they send it to pathology and get a report. This is something, you can see this machine right here that you can use. It's easier and faster. So this is method value G, confocal microscopy. So confocal means using focused laser beam and pinhole to create detailed three-dimensional image of a specimen. As always, many changes were made to the new technology section. First, let's look at the changes to the nervous system. A new row was added to code radiofrequency ablation of thoracic sympathetic nerve cardiac plexus. And you can see in the picture where the cardiac plexus is. It's a collection of nerves, right? Currently, radiofrequency ablation value 3 is listed only for renal sympathetic nerves. This adds the value for thoracic sympathetic nerves, cardiac plexus. This is for radio waves used to destroy tissue in cases of pulmonary hypertension. This is used for patients 18 to 70 when other therapies have failed. So here's another change to the same table, X05, new technology, nervous system. A new row was added to code for an investigational procedure, focused ultrasound brain tumor ablation procedures such as sonodynamic therapy. It's value 4. So what's sonodynamic therapy? Well, it's a minimally invasive anti-cancer therapy involving a chemical sonosensitizer and focused ultrasound. So a high-intensity focused ultrasound beam is used to destroy or denature, meaning deactivate, targeted cancer tissues. It's combined with a drug known as a chemical sonosensitizer to amplify the drug's ability to damage cancer cells preferentially, meaning it increases the ability to damage cancer cells and leave the other ones alone. So it prefers the cancer cells as opposed to healthy cells. Now, in the minutes, it specifically says that for this procedure in table X05, assign additional code as appropriate to describe administration of blood-brain barrier disruption substances or therapeutics when it's being done at the same time. So it's not included in the other one, it's coded separately. How is this coded? 3E043GN in the administration section. Okay, also in 72X27, this is cardiac vascular system. Dilation. This is for root operation 7, dilation of the thoracic aorta or pulmonary artery with device expandable interluminal device value 9. So it's also dilation of veins in thoracic aorta with device interluminal device cell permeable 5. So 2 different new devices in this table X27. Excuse me. So the cell impermeable device is interesting because it's 3 layers, and the middle layer is a block against cell migration and tissue accumulation across device layers. So this is done when there's stenosis, and you put this in, and it gets put in, and it keeps it from tissue or cells migrating there and causing it to close up again. So that's table X27. This is X28, also a cardiovascular system, but this time it's division. It's a new row for the table, division value 8, and this is used to code division, separation of the aortic valve leaflets or cusps using radiofrequency energy, and this is value W. Why are you going to do this? Well, when you're doing transcatheter aortic valve replacement, you want to prevent the new valves from causing obstruction. So they divide them up so they can't cause obstruction again. So table X2A, new technology, we're going back to cardiovascular system. A new row was added to table for root operation assistance. This is used to code dilation of cardiac artery with integrated embolic protection, value A. You see at the top of the picture, there's a filter. So we're back to filters. The top and also in the branch and also at the bottom. So this is for another filter during cardiovascular surgery. Separately report the appropriate code from table 037, dilation upper arteries for carotid artery dilation and stent placement. So you have one code from table 037 plus you have this code for X2A if you're doing this kind of filtration. So several changes were made to table X2H, new technology cardiovascular insertion. So this is for congestive heart failure, and it used to code insertion of a volume sensor management device, B, into the inferior vena cava. So this measures how the flow, okay? How much flow is getting through and how much is not because the patient has congestive heart failure. And this, of course, the heart doesn't pump enough blood to meet the body's needs, but how much is not enough? A lot not enough, or just a little bit lower than it's supposed to be. Also in this table, X2H, is new technology cardiovascular system insertion. So a new device substance technology value for temporary phrenic nerve diaphragm stimulation electrodes, value X. This device is inserted into the superior vena cava to stimulate the phrenic nerve or the diaphragm muscle, resulting in diaphragmatic contraction and facilitating respiration. And you can see that the device is, the radio transmitter is on the outside of the belt of the patient in the picture, and then you have the electrode inside the body. This is used for patients with dysfunctions due to a ventilator or to help patients wean off mechanical ventilation. This same table includes a new device substance value, conduit to short-term external heart assist systems, F. This is used to code for insertion of a conduit or connection to the patient's circulatory system to deliver support into the thoracic artery. Now, if you look at the picture, you have on the outside, look at the parts that's in white. You have the battery, you have the system controller, and then the white part going in, around the heart, that's the conduit. A conduit makes passage for passage. Okay, so that's what this looks like. Okay, there's also cardiac resynchronization therapy, CRT. This is for patients with heart failure. And if you look at the picture, you see the CRT generator and then the leads going into the heart, much like a pacemaker. So you have the generator under the skin, and then you have leads going into the heart. So table X2H, new technology cardiovascular system insertion. That's the pacing electrode, value 7, inserted into the left ventricle. It's percutaneous. Table XHH, new technology, skin, subcutaneous tissue, fascia, and breast, H, insertion H. So to do this, you need two codes, one for the electrode into the left ventricle and one for the battery into the subcutaneous tissue. Okay, so let's look at the final change in new technology for cardiovascular anyway, is root operation restriction. So they added a new interluminal device uncovered with support cuff, value 6, in body part values thoracic aortic arch and descending aortic arch. And this is to treat aneurysm. And you see a picture of the device in the bottom. And then on the right, you see the aneurysm. Of course, an aneurysm, there's a problem and the vessel balloons up, just like a balloon. And just like a balloon, it can only go so far and then it will burst. Okay, so that's why this is really vital, important to take care of. So that's all the cardiovascular. Let's look at gastrointestinal. A new table was added for root operation inspection, J. Now this is another code that was added for a specific device, specific product. It's called the PillSense capsule, L. It's an ingestible prescriptive device that uses spectrophotometry, light absorption technology to detect the presence or absence of blood in the gastrointestinal tract. And you can see it's swallowed, and then you see the video capsule moving through the small intestine. That's what I love about coding. It's just, wow. Learn all kinds of things. So let's look at tables XNH and XNS and XRG. Okay. So this new technology, body part value bones with root operation insertion, reposition, and body part value joint fusion. So different tables. So this is used to report pelvic fracture fixation and sacroiliac procedures using a threaded implant system designed specifically to meet a patient's needs. So this is in bones, and it's in the joints. Okay, and in bones, it's operation insertion and operation reposition. And you can see from the pictures, there's different types of devices to kind of meet the patient's needs, type 1, type 2, type 3, and type 4. So it varies, and it can be used more for a specific patient. So this is also for joints, XRH. This is insertion, used to report insertion of a molybdenum rhenium, posterior cervical thoracic spinal stabilization device, value G. So this device provides immobilization and stabilization of spinal segments as an adjunct to fusion for acute and chronic instabilities of the cervix and upper thoracic spine. So it says it's an adjunct, so that tells you need 2 codes. So code from table XRH, and then also a code for the fusion procedure, OGR. So next in new technology section is anatomical regions introductions. So as always, there are a lot of different medication substances added to this. The first one is Rystiggo, which is an injection used to treat generalized myasthenia gravis in adults. The second one is letrozole autoacylsol. Okay. I have these written off phonetically, so forgive me if I'm butchering them. And this is to treat patients with unresectable or metastatic synovial carcinoma. So synovial, it's in the knee, right? The next one is Doncilocicil June allogeneic. This is interesting. This is a cellular therapy medication to treat adults with type 1 diabetes. So you always think of diabetes with insulin, but this is something completely different. Next one is valoctocogene roxaparvovec. Treatment for adults with severe hemophilia. And the last one is iloprost, used to treat severe frostbite in adults to reduce the risk of digital amputation. And I have the letters, the value letters on here, T, R, D, A, and Q. So more drugs, resifungin, treatment of candida and invasive candidiasis in adults, value R. Vancomycin, anti-infective for lower urinary tract infections, including bladder infections in women. Next one is xanomeline trospiza chloride, used to treat schizophrenia. And finally, a pronounceable one, peptide-enhanced bone void filler, value X, promotes bone regeneration in areas of bone loss or defects. So substances were also added to the table XW1. This is transfusion. So these are mosafencogen, inotemcel, value S. This is for treatment of Franconia anemia, which is a complementation group A. This is when the bone marrow fails over time. And then non-autologous fibrogen concentrate, shelf stable, value Y. Shelf stable, this is a powder. So it can sit on a shelf for a while. You don't need to keep it cold. You don't need to do anything else. It can stay on the shelf for much longer. So another device was added to table XX2, new technology physiological systems monitoring. And you can see this on the patient's arm. This is to report the Dexcom Hospital CGM system, a real-time continuous glucose monitoring device, device D. It is used to monitor and manage glucose levels of patients aged 18 and older in a hospital environment. Now this one I think is really interesting. This is ticagrelor, value 9. It's an anticoagulant, and that's great. But if the patient is bleeding too much, or if they have to go into surgery, you want to get that drug out of the blood, okay? So in this procedure, the drug is removed from the bloodstream using pheresis. And that, as I said, in cases of decreased bleeding in general, to decrease bleeding in general and before surgery. You don't want any anticoagulant in your blood when you're getting surgery. Several new rows were added to table XXE, new technology physiological system measurement. So we have infection, computer-aided triage and notification, value C. This is to report sepsis using immunoscore technology to identify patients at risk. Okay, that is it. So here are my books on Amazon. You can go into Amazon's, type in get books, and then type in Tropin, and these will come up. You notice 3 of these are the 2026 updates. Of course, the E&M, the CPT changes are not released yet, but I have the PCS, the CM, and a book that has just has the changes for PCS and CM. That one in the upper right corner, ICD-10-CM and PCS updates. So if you have comments or questions, here's I am on Facebook. Here I am on email. If you want a copy of these slides, give the video a thumbs up and send me your email address, terrytropin@gmail.com, and I'll send you a PDF of these files. Thank you very much. I hope this was helpful to you.